Hello, my name is Brian. I'm a student of physical therapy at Regis University, and this is Ian. Today we'll be measuring Ian's aerobic capacity using an Astrad submaximal VO2 test. Right now Ian is warming up on the cycloergometer at a work rate of 25 watts, and he's maintaining a RPM of 50 RPMs. So Ian has been warming up for about 2 to 3 minutes. Before the warm-up, I took a few measurements on Ian. I measured Ian's resting vital signs. I measured Ian's blood pressure, his heart rate, and his rating of perceived exertion. Ian's blood pressure was 122/74. His heart rate was 63 beats per minute, and his RPE was 6. I also did a few calculations to measure Ian's submaximal heart range. 60 to 85% of Ian's heart range is 114 beats per minute to 162 beats per minute. And based on Ian's age, his maximal heart rate is 190. Okay, well, it looks like your warm-up's complete. So based on Ian's fitness level and the ACSM recommendations, I decided that we will work on a workload of 100 watts. So Ian will still maintain the 50 RPMs that he did during the warm-up. So now I will bump up the intensity. And let me know how it feels, okay?
Okay.
So you're going to feel a little bit more resistance.
Okay, sounds good.
Okay. Additionally, before starting the test, I determined that Ian will have no difficulty completing this exercise test. He's a physically fit individual who does not have any pre-existing cardiovascular risk factors. In addition to this, Ian performs aerobic and strength training 4 times a week. But even though that you are accustomed to exercising, please let me know if at any time during this test something doesn't feel right or you feel like you need to stop.
No problem.
Okay, Ian, well, it looks like you've been going on this workload for about 2 minutes, so now I'll measure your heart rate, your blood pressure, and your RP.
Okay.
Okay?
Sounds good.
So if you give me your arm.
That's right.
Perfect. You can return your arm back to the seat.
Okay.
Okay. We're going to write down a few things. So Ian's blood pressure after that was 128/74, and his heart rate was about 140 beats per minute. Ian, I'm going to show you this chart. Can you tell me what difficulty do you feel on a scale of 6 to 20?
Probably about 13.
About 13? Okay, that's perfect. Thank you. Write that down. Okay, so Ian, I'll measure your vitals again in about 2 to 3 minutes. And then after that, I'll measure your heart rate again. So ideally, we want your heart rate to, between my next measurement and the measurement after that, we want it to only increase by 5 beats per minute. That will tell me that you're in a steady state workload. So that, and then we'll end the test, okay?
Okay, sounds good.
So, do you do this often? Is this your first time?
No, this is my first time doing this exercise test.
How does it feel?
It's a little difficult.
It's a little difficult.
But yeah.
Yeah, well, we want to get you to slightly difficult level so that we can kind of see, so that when you are exercising, we can know how to prescribe off of that level.
Gotcha. That makes sense.
It's funny because we don't think of exercise as being so scientific, but really there's a lot of thought that goes behind it. A lot of thought that goes behind it. I do this with a lot of my patients, so that
Good.
I can really make sure that they're doing the most optimal use of their time when exercising.
Perfect.
Yes. Well, again, Ian, if anything doesn't feel right, let me know.
No, I'm good.
Perfect. You look like you're getting a little sweaty from it.
A little red.
That's okay. That flush tells me that you're having an appropriate response.
Good.
If you're getting cold, I'd be a little concerned. All right, Ian, it's been about 2 minutes, so let's measure those vital signs again. Okay. So I'm going to borrow your arm. Oh, that is stuck here. Put your
There we
arm.
go.
Perfect. Then I'm going to take your blood pressure. Perfect. And then I'm going to show you this chart again. Let's go 6 to 20 again. How do you feel? 20 being extremely hard, 7 being, it's pretty easy.
Let's go about 17.
17? Okay, perfect. Thank you. So that time, your heart rate increased a little bit to 144 beats per minute, and your blood pressure increased also to about 130 over 72.
Gotcha.
Perfect. So, Ian, we'll wait for about 10 more seconds, so 1 minute after the last one, and I'll measure everything again,
Okay.
and we'll see.
You can just do heart rate this time.
Alright. So I'm going to measure your heart rate. Perfect. Well, Ian, I have great news. Your heart rate this time was 148. So that means that it increased by 4, which is right in that steady state range. So because of this, I know now that we can start our cool down. So I'm going to drop Ian down to a rate back to that 25 watts. And Ian will cool down for about another 2 minutes. After those 2 minutes, I'll measure Ian's heart rate, his blood pressure, and ask him his RPE one more time. Well, that concludes our Astrad test. Thank you, Ian. You have been a wonderful participant. Do you have any questions for me?
No, thank you.
Of course. You did a great job.